Well, let's get straight to the exciting news because, of course, you're here in Abu Dhabi for a particularly good reason this week. You have a partnership agreement, I believe, that you're signing. Tell us about that.
Yeah, I believe we're signing it today. We're signing an agreement with SSMC to partner on healthcare. So that could involve bi-directional sort of visiting physicians here to teach and learn and establish programs, potentially some educational activities together where some trainees can come to the US or some of ours can come here, some research opportunity to study lung disease here. So we're excited. It's a sort of open collaboration. We're excited in where that's going to take us. We're open-minded about it. We're excited and hope to really get great things out of it.
Hello and welcome to another edition of Health Beats, brought to you in association with Abu Dhabi Global Healthcare Week. I'm Steve Gardner, Managing Director of Healthcare World, and we are actually here in person at Abu Dhabi Global Healthcare Week in our little studio in the corner while the exhibition and conference buzzes around outside. But if you can't be here in person, you can subscribe to Health Beats on Apple Podcasts, on Spotify, wherever you get your podcasts, for lots and lots of great content. And I've got lots of great content today, particularly I'm joined by Momen Wahidi, who is the Medical Director at the Canning Thoracic Institute, joining us in Abu Dhabi, direct from Chicago. Momen, how are you? How are you finding Abu Dhabi?
Thank you, Steve. I'm doing great. I'm loving Abu Dhabi. It's such a vibrant cultural city. I think it's my second time. My first time here was one day. So I've had more time to explore the city and learn about the culture. And it's really a pleasure to be here in the Global Health Week, where I'm meeting a lot of great people in healthcare and trying to collaborate and learn from each other.
Well, before we get into the healthcare chat, the first question is, have you visited the Grand Mosque yet? Because
I have.
Really is.
I have. That's really a wonder.
It's incredible.
Incredible sight. What a beautiful building. And
it's unbelievable. You don't actually get an idea of scale and size. When you see it from a distance, it's a beautiful mosque, but it could be a beautiful mosque, small one in any city. Then you see a double-decker bus roll past it, and you realise that it's absolutely enormous.
It's majestic, and you're humbled there when you walk in that mosque.
It is incredible, isn't it? So tell us about the Canning Institute then, and how did you bring your world-leading pulmonary medicine to the Middle East from Chicago?
Yeah, so our Canning Thoracic Institute is part of Northwestern Medicine in Chicago, Illinois, in the United States. We're an institute that oversees lung health for our health system. So we have about 11 hospitals in Chicago, and we have an international reach that we're really proud of from a collaboration perspective. But, our mission is to deliver state-of-the-art healthcare to our patients with lung issues, combined with groundbreaking research and a holistic approach to our patients, team approach, evidence-based approach. So we're proud to deliver the best quality care. And what brought us to Abu Dhabi is just looking for partnerships with, great leaders here in Abu Dhabi in health, and to try to collaborate and learn from each other and spread knowledge and share innovation and best practices.
Well, let's get straight to the exciting news because, of course, you're here in Abu Dhabi for a particularly good reason this week. You have a partnership agreement, I believe, that you're signing. Tell us about that.
Yeah, I believe we're signing it today. We're signing an agreement with SSMC to partner on healthcare. So that could involve bi-directional sort of visiting physicians here to teach and learn and establish programs, potentially some educational activities together where some trainees can come to the US or some of ours can come here, some research opportunity to study lung disease here. So we're excited. It's a sort of open collaboration. We're excited in where that's going to take us. We're open-minded about it. We're excited and hope to really get great things out of it.
It's one of the wonderful things to think about this region from a healthcare point of view is the ambition and the drive that they have, the Department of Health here in Abu Dhabi, to try and develop that kind of knowledge, that kind of specialty. Have you experienced that kind of hunger for development in this system?
I have. I've had the privilege of going around the last 2 days, visiting various hospitals and meeting with some fantastic people. And I've been really impressed. I mean, I've traveled a lot throughout the world, but the region here and the leadership is so open to collaborate and to bring expertise here to the people of the United Arab Emirates. It's not always about leaving and going somewhere else. They really genuinely want to have top of the top care here, medical care, and that's really refreshing. And it is a privilege for us to come and be part of that.
It is a kind of flipping of the narrative to a great degree, because if you look at the Middle East from a healthcare point of view 5 or 10 years ago, a lot of the time it was about patients coming out of the region to go and have treatment in places like Chicago or the UK, whereas now it's that drive and desire to be able to develop local specialist care. And what you guys do is very, very specialized, isn't it? Tell me a little bit about some of the innovative capabilities, got some of the things that you've developed.
So, I mean, we're a comprehensive lung health service line. So we go from simple bread and butter stuff like asthma to really complex, advanced lung disease and lung transplantation, which we're now, I'm proud to announce we're the largest program in the U.S. We did 148 lung transplants last year, 2024, and tackled really difficult, challenging patients and gave them hope to survive, their health issues. We have been combining research and leading edge medicine to help our patients. For instance, we were the first center to do lung transplant after COVID. People got affected by COVID and really had damage to their lungs.
I'm curious about that, because obviously COVID was a disease that heavily attacked the respiratory system. Did COVID complicate, or did you start to see lung issues, lung problems that were different as a result of the COVID pandemic?
Definitely. So it was a spectrum, right? So some people had mild disease and they were fine. That's many of us, I think. The majority of us had.
I think out of that 6 times.
Felt like a cold and you're tired and you slept it off. But there were patients who had other factors that made them much more vulnerable to severe disease. And to some, they had complete destruction of their lungs to a degree that they couldn't breathe anymore. They needed oxygen. They needed a ventilator. Those are patients that really needed something like lung transplant. The other thing we see is what we call long COVID. When you get COVID, it's mild, moderate, but then you're left with symptoms for months from shortness of breath, inability to.
I've had friends that have suffered with long COVID, and it's been completely mysterious as to why or what's affected. I'm really interested in it.
Yeah, and we actually at Northwestern established a long COVID or post-COVID center that has multiple expertise. So it's not just lung, because also neurology. So you can have some fogging, and some sort of inability to have good balance. And so we have cardiology, we have neurology, we have pulmonary, all working together to address these patients with long COVID, no matter what organ system was affected. And we're proud of that work. And again, we can always share our knowledge and expertise here with people.
From my understanding and knowledge, long COVID has been a bit of a mystery, in the respect that people, or we don't have a complete understanding of what's causing it or how to actually mitigate the symptoms of long COVID, because it's many things, right? How far along the line of understanding long COVID are you and being able to treat it?
I don't think that we fully understand why. We think it's some sort of impact at a cellular level that leads these sequelae and consequences, but we don't truly understand. We don't have really like a specific treatment for post-COVID. Our job is to handle the systems, the organs that were affected, and try to mitigate some of these issues caused by COVID. But to your point, there's a lot of great ongoing research, but we haven't gone to that level of certainty of what happens and why some people get it. Other people, a good majority don't get it.
Yeah, absolutely. And I guess leading on from that, the expectation broadly is that this is not going to be the last pandemic we deal with as a human race. How are you, and actually the next one is likely also to be respiratory based. In terms of your kind of research and your work, have you done any kind of future planning in terms of trying to get us into a situation where we're ready for the next pandemic?
Yeah, I mean, I think one good thing that might have come out of this horrible COVID pandemic is now we learned a lot.
Yes.
We learned a lot of lessons. I think there were things that we probably wouldn't do again, and there are things we definitely would do. Just the overall preparedness and how to deal with a pandemic, I think was a wake-up call to all of us in healthcare and in leadership and in government, probably. So I think there's a lot of good lessons to be adopted for the future.
And as respiratory specialists, as lung specialists, how was COVID for you and for Northwestern? How did you cope?
It was definitely scary. We're at the front line in respiratory medicine because we also do critical care. So our physicians, our nurses, were at the front line. And remember back in that period, March to sort of November, until vaccines were available.
That was the scariest part.
That was the scariest part. You were thrown into this unknown of, am I going to get it as a healthcare worker?
Yeah.
And also feeling terribly sad and ineffective with some of your patients that are dying in front of you, because at that time there was a lot of uncertainty of what medication to give these patients and how do we protect them and their loved one, our loved ones. So it was a dark time. Those 6 months of pre-vaccines, that was very tough.
Absolutely. And from a workforce point of view, that was also an incredibly difficult time to deal with your healthcare workforce, wasn't it? You had a lot of scared people almost living in a war zone.
Absolutely. I remember you had to, what we call donning and doffing of these special, clothing or protective equipment. So it would take 10 minutes to get to the patient in the ICU. You come into this adjacent room and you put everything, the covering on your body. And then when you take it off, you have to go very methodically, piece by piece. And so it's a tremendous burden. I hope we never see it again. I hope we never have a pandemic again, but we probably will.
The predictions are pretty gloomy in that respect, aren't they? We're going to have something like this at some point in the future, and we're going to have to deal with it.
Probably. I hope it will be easier the next time around. If it happens, I think, again, we've learned some valuable lessons.
Absolutely. Picking up on that point about the workforce, I know you're also an education and training centre, aren't you? So in terms of the partnership that you've got here in the UAE, is that going to be about developing clinicians, developing workforce for this region? And is that coming through the Pure Health partnership? So it's going to be in the Pure Health hospitals, the SSMC hospitals?
Yeah, I think we're open to collaborating at any level desired by here at the local hospital. I think, again, we can start, it's always bi-directional. So I think we can start potentially with the visiting physicians that can come and evaluate an area that is not available or has not developed yet to that level that we have in the US, and see how can we build it here. And could we train physicians to do those techniques of surgery? Can we provide the infrastructure or the organization structure to stand up a program like that? And then, can the physicians here come to the US and observe us and see the techniques and learn and then bring it back?
What's the sort of level of clinical capability in your specialty area here? How advanced are they in terms of their understanding of the
I think they're very advanced, but there are things like lung transplantation is only available in one hospital in Abu Dhabi, so it's not available in SS yet. So I think that's an example. And lung transplant is a very specialized, complex area of medicine, because it's not just about the surgery, it's about the pre-care and the post-care. The pre-care to be, select those patients very carefully to make sure that they withstand the surgery and they do well. And the post-care is a very involved process, because we gotta monitor those precious organs and make sure they're not getting rejected by the body. The patient's not getting infection, because we're giving them medication to weaken their immune system somewhat, to not reject those new organs. So that means they're more susceptible to infections. And we want to make sure that we are watching them closely, giving them the right treatment for infection if they have them. So it is an involved, and it's a very much of a team-based care. So it's not just physicians, it's nurses, coordinators, nutritionists, pharmacists, social workers, respiratory therapists. So it takes a village. So, some things may need time to develop, and some patients from the UAE may have to travel to Chicago or other places to get that level. But the hope is, especially with the wonderful investment here in the UAE and Abu Dhabi, to get to that level. And we're on that journey with the folks here in Abu Dhabi.
What's the difference what differences have you seen between this health system here in the UAE and the system you have back in the US?
That's a great question. I think it's hard to pinpoint it really, but I think here the commitment to advancement is wonderful. And it's what we had sort of a while ago in the US. The insurance system is different. And so how people access healthcare is a little different. One thing I learned is, how people go to the emergency room here. It's different here than the United States. I was walking through your emergency room yesterday, and it looked like a hotel lobby, and there was two people. If you go to the U.S., the emergency rooms are overrun, crowded, lots of people waiting, different. I also learned, here, primary care, internal medicine, it's different. There in the U.S. and maybe in the U.K., we rely more on the primary care to sort of be the maestro or the generalist.
Well, certainly the gatekeeper. One of the things that I think is quite interesting about the Middle East health system generally, and the UAE in particular, is that general practitioners, general medicine specialists, for many years have almost not been seen as proper doctors. It's like there's a standing, what do I do if I've got a headache in Saudi Arabia? I'm going to see a brain surgeon. And that, of course, comes with some real challenges because you're not maybe picking up abilities or particular issues.
Yeah, so I think, this is something that probably will change in the future, but
it's changing rapidly.
Having a general practitioner, primary care physician, we call him in the US, to be the maestro that knows everything about you and then make the appropriate referrals is a model that works. It's going to take time, like you said, to build that trust in their abilities. And
one of the wonderful things we might appreciate about this is the fact that they've now started calling them family medicine consultants to try and give them that kind of title and status that people will recognise. But you're right. I mean, it is starting to kind of pull through from that point of view. I'm going to ask you a bit of a controversial question. How do you see the health system in the US developing at the moment? Obviously, we live in interesting times from a political point of view. Is that going to affect the way healthcare is delivered and evolves in the US?
I think we're all concerned about potentially the decrease in funds from the government to support research. I hope that we can resolve that. Healthcare can only advance if we have solid research on multiple levels, on a basic science level, on the clinical level. And frankly, in the U.S. has been leading in healthcare in the world, predominantly due to the ability to do research and discoveries and find new treatment and drugs for common diseases. So, I'm hoping that we all sort of find a way to continue that funding and make sure that our research is, without groundbreaking research, we can't make advances. I think that's the main thing. But other than that, I think, the healthcare system in the U.S. is pretty robust. We still have issues with insurance, like lots of developed countries, and access to care and having full insurance for some patients. So I think those are common problems for many countries.
What about you personally? What's your personal journey been to this point? What's your kind of career history? How did you become a lung man?
Yeah, so as we all go through training, I had many options and was thinking about everything, all
Are
specialties.
you from the US originally?
I was actually born in the Middle East. I was born in Syria, and
Okay.
then
Yeah.
immigrated to the United States. So did my education. But
Always in Chicago?
no. Actually, I spent a lot of time in North Carolina.
Right. Okay.
So Chicago is a new home for me, but I've loved it.
Yeah.
Been there for 2 years, and it's been a
So we were
wonderful.
talking in the preamble, weren't we, about how wonderful Chicago is?
Yeah,
Would you recommend Lou Malnati's pizza?
It was
Lou Malnati's was the one that I always...
Oh yeah. Yeah, it's
For
one of
those
the
of you
best
watching-
pizza.
For those of you watching who don't know proper Chicago pizza, the cheese is at the bottom and the tomatoes at the top.
It's wonderful pizza. And then you have to try deep dish pizza here in Chicago,
Yeah.
which is very kind of thick pizza. It's almost like a cake. It's very thick. It's not your flat crust, big crust, but it's not for everybody. But you got to try it. This is very Chicago.
Yeah, no, absolutely.
Yeah, so I chose pulmonary medicine because I really had this idea of there's nothing worse than not being able to breathe. That feeling of suffocating or not being able to breathe. And then I watched people smoke and now vape, and it frustrated me that people, have these unfortunately habits that they sometimes can't control. And so I wanted to help in those aspects, and sort of my training evolved. And I'm actually an interventional pulmonologist, so I do procedures to diagnose lung cancer and treat it along with other specialists like oncologists. So I'm passionate about lung cancer, to find it early, to screen patients for lung cancer, to help people stop smoking, and then to find cure for the lung cancer.
Because there's a really important point that needs to be made here, that public health is an incredibly important aspect of any healthcare system. Public health and public health messaging around things like smoking and vaping. How much are you seeing, or how much have you seen of that in this region, and how well does that work back home? Because it does feel a little bit like sometimes public health becomes the kind of forgotten element of healthcare.
Yeah, no, I mean, in general, healthcare in the last few decades have focused on treating the disease, less so of preventing the disease, right?
Yeah.
And we're trying to change that. We want to make sure we work on prevention. And so, smoking, fortunately, the smoking rate are declining.
Yeah.
And that's the effort of a lot of people, education, exposing the risk of tobacco, and stopping all the advertisement that the tobacco companies are flooding people with. So we've made a lot of progress. I think there's still higher smoking rates in the Middle East and Asia as opposed to Europe and the United States. But vaping is what really concerns me these days, because it's unfortunately getting to our teenagers and young adults. And, these companies are making it flavorful. And not, the smell of tobacco is gone. So unfortunately, what people need to know that you are inhaling chemicals that are unknown, that are not regulated. That if you do that to your lungs, we don't know if they're going to cause cancer or not, but they can cause a lot of other things.
Have we got any idea as yet about what the effects of vaping are on the lungs?
Vaping is relatively new. I think came around, I want to say 2008 or so. So we don't know the full effects. We have some research showing that it really affects the cells in our lungs similar to tobacco, but we don't know yet because it hasn't been long enough. But we know that lungs were not made to put chemicals in them on a daily basis. And again, unregulated chemicals by factories, God knows what they put in those vapes. So sort of more sad statistic or research is that teenagers who vape are 4 times more likely to pick up cigarettes. So we've done all this work to educate people about not smoking, but now we get vapes, and that vaping is making people want to pick up.
There's almost an insidious element to this, isn't it? Because of course vaping was sold as a way of giving up smoking, and then kind of crept into our social consciousness. The other element, of course, of concern is pollution. How much is the environment, is the pollution of the atmosphere affecting our lungs?
Certainly, pollutions in big cities is a big problem in the United States as well as in India and Asia and other countries. And it has an effect on airway disease like asthma and COPD, chronic obstructive pulmonary disease. But it also, if you look at the statistics of lung cancer, it is estimated that 1 to 2% of lung cancer death are related to pollution.
Wow.
So it's sort of the silent, you know, harm that you don't think much about because you live in a city, it's polluted, it's your life. But certainly we all, need to be proactive and do our part to protect our environment.
You talked about the preventative agenda earlier in the conversation. I wonder how that's developing. So as we look at things like the Emirati genome program, as we start to sequence genomes, as we start to see data, is it possible to pick up predispositions to lung cancers and to respiratory disease using that genomic data? Can you see a future where we're able to pre-treat people who are potentially going to develop these?
Yeah, that's always been the hope, to know who are the patients who will develop lung cancer and how can we prevent it. One thing I'll share with you, obviously smoking is always harmful, but only about 15 to 20% of smokers get lung cancer.
That's still a big.
That's still Russian roulette.
Yes,
one out of five.
Exactly.
But it's not 100%. So some of my patients say, "Well, see, it's not everybody."
Yeah.
But this is a high chance. But it's really lung cancer is always sort of an interaction between environmental exposure to tobacco and genetic susceptibility. So there is a genetic component, and we need to understand that better to know who these patients are and try to help them, first help them quit smoking and also then help
the
them
ability
mitigate
to
that.
turn around and say, you are one of those 15 to 20% that will develop lung cancer. Do we see us getting into a situation where we're able to predict that with accuracy?
I think so, because one of the greatest advances in the treatment of lung cancer in the last 10 years is now when we have somebody with advanced lung cancer, we actually test their cancer cells for genetic mutation. And now we're finding there's very common mutations that cause that lung cancer or those cells to mutate. So things like EGFR and ALK and ROS1. And so now actually treatment of lung cancer, we have to know, we have to test for those genes and see what gene led it, and then treat with treatment that are directed toward that gene mutation. So certainly we made a discovery in sort of later in the cancer. Can we move it upstream and find those genetic mutations that would predispose those patients to developing lung cancer?
How far away do you think we are from having that level of knowledge?
I'm not going to underestimate science or AI or things like.
It's that great Bill Gates, though, isn't it? We overestimate how much change we're going to see in the next year and underestimate how much we're going to see in the next 10 years.
I mean, my optimistic side would say, maybe we're 5-10 years away from that. And maybe with all the advancements in the AI power that we're going to have, that we will get to discovery much faster than we used to.
Of course, there's a great irony when you link that to what we were talking about before, that the AI power that we need is going to be so much more energy and then potentially more pollution. So let's see which one wins the race.
Yes, exactly.
But talking about like what's going to happen over the next 5-10 years, what are you excited about in your specialty area? What do you see as the big developments in your area over the next 5 to 10 years?
I'm excited about how we can offer new treatments to our patients. So one thing I didn't talk about much is, in our lung transplant program, we started what we call the DREAM program, which is offering lung transplant to selected patients who have lung cancer, advanced stage lung cancer that's confined to the lungs. That's new hope for patients who have stage 4 lung cancer, have tried everything, tried chemotherapy. And
I suppose the lung is quite a large organ, isn't it? So from a lung cancer point of view, there is a reasonable chance that actually it might just stay in the lung, because once it's got outside of the organ, you've had it.
Typically, it's worse prognosis. But if it's limited to the lung and diffuse in the lung, it's a slightly different biological sort of structure of that cancer. And those we can potentially help with lung transplantation. So we were the first center in the world to do that DREAM program. And we're seeing some really good results that we publish about. But things like that, to take existing problems and think of innovative ways to approach it, to help that patient, that friend, that family member who's having this devastating lung disease or lung cancer, and try to help them breathe better and spend time with them.
I mean, that's incredible. And that I find inspirational. And it's a great place for us to finish. We're out of time. Momen, thank you so much. It's been a really fascinating conversation.
Thank you.
And thank you for watching. This has been another edition of Health Beats. If you haven't already subscribed, get yourself on Apple Podcasts or Spotify, wherever you get your podcasts, and do it now, because we've got some incredible conversations already there and many more to come. We'll see you on the next edition of Health Beats. Thank you.
Thank you.